This is physical therapy diagnosis. This measurement is a measurement called FABER position, F-A-B-E-R. Okay, so here's the measurement for the FABER position. What we're looking at is the angle of the knee, or the hip, and the distance of the knee from the tabletop. So let me show you the measurement here. I always use centimeters on a tape measure just because there's more of them. Okay, go from the lateral femoral condyle right here, put your 0 mark right there, drop it right down to the tabletop, which 17 centimeters, and that's a normal value when we compare it against our all the measures in our database. But to truly decide if that's normal or not, we have to compare it to her other side. We're going to measure the other side. Can't really pick it up with the camera the way we've got things set up. Note that we want to keep the pelvis level, the lumbar stable. Okay, so we're not going to let the opposite hip bone, this is the ASIS, we're not going to let that come up. I'm going to take the measurement the exact same way I just showed you, and 20.5 centimeters. So there's a little bit of asymmetry, there's a little bit of difference in the range of motion. Her right hip is a little bit stiff, and that is a treatable finding. We could do some range of motion or some... Okay, so this has become the treatment. We found that her right hip was stiff, so we would recommend she perform this stretch. We call it the FABER position, Flexion, Abduction, External Rotation, and I would recommend 2 minutes at a time, maybe once, maybe even twice a day, and we have it all on diagrams and on web video for the patient to follow along. And that